right, so this is the final IV setup that I will show you. We're using a different kind of IV catheter. There are others on the market, of course. This is a B Braun IV. This is an extra long one. You would normally see it be much shorter, but this is what we have today to work with. So this one, you want to pop off the safety. This little button here is how you know where the bevel is facing. So as you can see, I don't know if you can zoom in on that. The sharp part is at the top here and it opens this way. So that's how you know which side to go in upwards. So same idea, you would get into the vein, thread the catheter and remove the needle. Needle safety device is in place, and this is now in your patient. So what you'll notice that's different is there is no extra tubing here, so blood will immediately begin to flow in these catheters. What I do is I pull it out. You can either occlude the vessel with your finger and attach, or you can place a sterile 2x2 underneath and immediately connect your syringe to draw your lab work. An alternative, and what you will need eventually, is your pigtail. Comes in a little container. So this is a pigtail that connects. See, it already has the cap on it in this one. Top comes off, and this connects directly to the IV catheter. So this is in your patient, and this is connected externally. You can do one of two things. You can connect a syringe, draw labs with your syringe. You can connect the blue device and put your vacutainer tubes on here. The only caveat with this is you will end up with about a half a cc of air, or a little bit more than that, inside your first tube because of the air that's in the tubing here. If you want to avoid that, prior to connecting your piggy tail, you can put this directly on the IV site itself, and then you would not have any air. You can connect your vacutainers. It's just a little bit messier because then you have to switch this twice, and this is not a bloodless system. Once you've drawn your labs, you would flush again. Through your IV into the patient. If your patient does not need lab work, you can pre-flush this setup. I have the lid still, right? Maybe that's not for this one. Here it is. So you'd get your setup out of the container, you could pre-flush it, get it ready, put your IV in, and then immediately connect a flushed pigtail. This would come out. Your clamp on this is a little bit different. There's one side that has a larger opening and one side with a smaller opening, and you just slide it across.